we have a presentation from Ashley. Oops.
Okay. So I'm just going to give you an overview of what we've done so far with the COVID-19 vaccination effort. That is a picture of our very first pod. You can see that there was a lot of people that staffed that pod. We're now running pods with about 5 staff members, so sometimes less. We have held 70 vaccine clinics to date in 18 different locations throughout the county. We have provided 4,099 first doses, 3,209 second doses. We vaccinated 311 students, 210 of our homebound residents, 40 migrant workers, and 14 inmates. Yes?
Is that difference between the 4,000 and the 3,200 because some were Pfizer and they only needed 1 shot, or?
So we've provided first doses. We haven't gotten to the second dose clinic yet.
Oh, okay.
And some are Johnson & Johnson, and they don't require
Johnson
the
& Johnson,
second.
okay.
Are those all the inmates? Did all the inmates get vaccinated?
Not all of them, no.
By choice of theirs?
Correct. Yep.
Okay, thanks.
You're welcome. So this is a breakdown by zip code of the percent of the adult population that's fully vaccinated. So they've had either 1 dose of the Johnson & Johnson or 2 doses of the Moderna and 2 doses of the Pfizer. So we have concentrated efforts in the southern end of the county. We've held 2 clinics in Seville, we've held clinics in Turin, clinics in Osceola and Port Leiden. We've also, the other red area is Casterland there. We have held clinics specifically at the Casterland Fire Department as well. I do want to make note, you'll see Harrisville, Carthage, and Natural Bridge are quite high, and you'll see Fort Drum does not have a color associated. That is because the Fort Drum data is not reported to the New York State Immunization Registry. So our hub takes the data that they provide to them and distributes to zip codes based on population around Fort Drum. So that is most likely why those areas are as high as they are. This is the percent of the adult population with 1 COVID-19 vaccine here. And this is the measure that the governor has set, and actually we've met as a state. 70% of the adult population throughout the state has received at least 1 dose of the vaccine. So the only zip code for us that is below 40% and is listed as a zip code needing improvement is the Seville zip code. And we have been there twice, and we did have fairly good participation the last time we were there, just most recently at the end of May. We had 30 people, which is pretty good. This is the vaccines by age group. I want to make note that our 15 to 19-year-olds, they're quite high for only having been eligible now for about a month for the vaccine. We've got 39% of those. We drop a little bit for the 20 to 29-year-olds. That's certainly a population we should concentrate on. The other important thing to note is we have really good coverage in our 60 and up, which we know is the population that suffers most with the COVID virus.
Ashley, is the higher number for 15 to 19 because you're right in the schools, perhaps?
It could be. I think there was quite a few. When you go to school, you have a higher chance of being quarantined because we're doing contact tracing within the school where, 20 to 29-year-olds, maybe not so much. So being vaccinated prevents the quarantine. So I do think that was a strong, and we also, so it goes to 19. There was talk of the vaccine being mandated for SUNY and CUNY colleges, so that also drove people to be vaccinated as well.
Actually, it's correct too that minors have to get parental consent, don't they?
Yes, yep,
Okay.
absolutely. This is the vaccines by gender here in Lewis County. Females are tending slightly more to be vaccinated. This is a progress towards the 70% goal here in the North Country. We are lagging behind a bit. We're currently at 55% of our total total adult population with at least one dose of the vaccine. So we have 2,957 more people to go to meet that 70% goal. And this is up to date with the latest data. Some of our upcoming vaccination efforts, we've got the drive-through clinic, which we're providing second dose Moderna and also Johnson & Johnson this Friday from 3 to 7 at the Loudville Fairgrounds. We also are doing a clinic that morning at the Loudville Fire Hall. And that'll be again for second dose Moderna. We're going to do first dose Moderna and Johnson & Johnson at that clinic. We're continuing to work with farms and other large employers to set up clinics. We actually have a farm that we will be going out to on Friday to vaccinate more migrant workers, which is good. Continuing to vaccinate the inmates and homebound as needed as we learn about them. We have a good relationship with the jail. When they have somebody that wants the vaccine, they just call us and we work around clinics that we already have scheduled. That way we're eliminating waste as much as possible. Same thing with the homebound. And we're looking to go to large events throughout the summer. Obviously that'll be an ideal place to catch a lot of people. Some of the other counties are doing that. Some have had success and some have not. So it's something we can try. We are looking specifically, we have a booth at the fair every year, so possibly providing vaccines there.
Would you do that every day, actually, at the fair?
Yeah, yep. And then we're going to start providing vaccines in our office by appointment. So summer is extremely busy with back to school vaccines for us. So this provides a good opportunity if they're 12 and above to offer the COVID-19 vaccine as well. So we'll be providing that in our office by appointment. We'll clump as many as we can get together.
When will you start that?
Probably towards the end of the month. So we're currently, this week we're finishing up our second doses in the schools. You know, we're trying to, as we finish one effort, come up with another way that the population can get vaccinated. And they always have the option of going to the pharmacies as well. Locally, Kinney's and Walmart both have the vaccine. And there's still opportunities at state vaccination sites too, but.
You still have an appointment for Kenny's, right? You just can't walk into Kenny's.
No, it's still.
You have an appointment, same with Walmart? Or?
Yep.
Can students get a vaccine, 2 different vaccines at the same time? Like you said, you're vaccinating students over the summer?
Like if they were getting
back
like
to school?
Like an MMR and
Yeah.
that's what they'd be getting.
Well, right, it wouldn't be any live vaccine. They wouldn't be able to get but most of the time, your older students aren't getting the live vaccines anyway. So yes.
They could get them both
Yes.
at the same appointment?
Yes. And then lastly, I just want to thank all of our volunteers. So throughout all of the 70 clinics, we've had quite a few volunteers that have helped us along the way to keep things organized and increase throughput. What questions do you guys have?
Do your numbers include people that might have went to like Rome, Walmart and got it?
Yes, anybody that's been vaccinated in New York State, and snowbirds that may have been vaccinated in Florida, or if they report to either their doctor or us, so we can put it in the New York State registry, or if the doctor puts it in their medical record, that data is still reflected in the data that I showed you.
Well, probably a lot of the snowbirds have not taken that step, right?
Correct, yes.
So
There's certainly
our
been
numbers
some.
could be a lot higher.
They could be, yep. Yep.
And Jerry might be able to answer this question. When, any indication like when people being discharged from the hospital will be able to get it?
We would, if there was somebody who wanted it, we would work with public health. And the issue is once you penetrate the vial, then you only have so many hours to dispense, and we don't have that level of need.
Any other questions for Ashley?
Just want to thank you, Ashley. You've done a great job.
Great job.
Absolutely.
Thank you.
You and your team did a great job.
Yeah.
And all the volunteers.
Thank you very much.
Thank you too.